Well, good morning and Happy New Year, everyone. Thank you for joining us today, our first event of the new year. The ASU Retirees Association is so excited that you've taken this time out of your day to be here with us. We've moved to a different topic. Today we have Medicare 101, and hopefully you've already designed your questions and got some ideas, and we have some great information. Joe Craney, Jr., and Joe Craney III are here to share great information with us and offer a question and answer either as they go or at the end, whatever is best for their presentation. Thank you, and I'll talk to you later.
Thank you, and welcome everybody, and Happy New Year. We are here to tell you a little bit about Medicare, give you a little bit of an education, and hopefully give you some more information so that you can make a wise decision moving forward. Our company is called Senior Preferred, and that means that we are Medicare brokers. So that is advantageous to all of our current clients because it means that we don't represent just one company or another. We represent a multitude of different companies with different types of plans to fit every sort of need. We don't work for the government or a specific company, and we do about 80 of these presentations a year. And this is a good way for us to meet potential new clients and to educate people. This is not a sales event. Medicare does require that I let you know we're not going to attempt to sell you anything at all today. This is purely educational. This workshop is intended for you to learn and to understand about Medicare. Medicare does not allow us to discuss any company-specific benefits, but we are going to talk about the different types of plans that are available to you so that you have the information you need moving forward. What we are going to be covering, what is Medicare and who's eligible to receive it. We're going to be talking about some of the different Medicare enrollment periods that will apply to your situation, the parts of Medicare and how those individual parts work, how much is the cost for Medicare, common misconception that I'm going on to Medicare, it's going to be free, different coverage options and benefits that go along with them. Medicare is not one size fits all, and as we go through our presentation, you're going to see that. And lastly, we're going to help you avoid late enrollment penalties. Now, all of the information that we have gathered is actually through CMS, which is the Centers for Medicare and Medicaid Services. So that's actually through the government information that they've put out, as well as Medicare.gov. We put it into a presentation which we feel like is easy to understand. So the way that we do our presentations and like to teach people about Medicare is we're building a story and we're starting with the fundamentals. So we're starting with the basics and we're moving up from here. I think it's very logical that you're going to have some questions that are going to come up about your specific situation. Please don't be offended if we tell you, hey, we're going to answer that in a moment because we have a logical way that we go through this. Having said that, we do encourage questions. So you have some folders in front of you there, and the first page in your folder that you're going to see is going to tell you a little bit about us, about Senior Preferred, myself and Joe Jr. Next in your packet, you're going to see how to order Medicare and You, and we're going to talk a little bit more about that in a moment. Medicare enrollment periods that would apply to your situation, the parts of Medicare, and this is really kind of the meat and potatoes, and then a side-by-side comparison of the two main plans that you have the option to go on once you've decided you want to go on to Medicare. So Medicare can be quite confusing, and usually I kind of leave this as an open-ended question, and I just ask the audience, who here thinks Medicare is confusing? And usually I get about 85% of the room raising their hands. We definitely feel like it's confusing. That's why we do these presentations, to educate people. But really when you get down to it, if you understand the fundamentals of Medicare, you're going to be in a position where you can make a good decision. And that's what we're hoping to help you with. All right, Medicare and You 2020. This is a book that's put out by CMS. That's the Centers for Medicare and Medicaid Services. So this is a book that you're not going to certainly want to read front to back. It's not a great novel by any means. But if you're looking for some information, if you're looking to understand a certain part of Medicare, if you're looking to do a little bit of research, that can be very helpful for you to pick up. It is available to you online. It is free, or you can have them send you a physical copy in the mail.
Well, welcome. As you know, my name is Joe Craney. I'm the dad, and obviously he's the son. I would like to say one thing before I get started with my slide is go Devils. Yeah, yeah, that should have been the first
I
thing
should have said that, yeah. You're right.
Now we're getting it, aren't we? All right. So what is Medicare? Medicare is CMS, the Center for Medicare and Medicaid Services. Medicare is available to individuals age 65 and older, as well as certain individuals who may have disabilities when they're younger. You're eligible for Medicare at age 65 if you're a U.S. citizen or a legal resident, you have resided in the United States for a minimum of 5 years, and you've worked at least 10 years and paid into FICA. We want to tell you right up front, Medicare does not cover everything. There's something called a gap. We're going to talk about very briefly what gaps are in coverage. So Medicare generally covers 80%. 20% is going to be a gap in coverage. There are plans that we're going to tell you about today that are intended to fill those gaps. So the theory is Medicare covers 80. These plans tend to pick up some or all of the remainder, okay? Do I have to take Medicare at age 65? This is the #1 question we get. And the answer is no, you do not have to take Medicare. Everyone's situation is going to be unique. Some people may plan to continue working. That's the #1 situation that we run into. If you do plan to continue working, you have a choice. You can go on to Medicare or you can keep your current health care plan. I can tell you that the majority of the time, actually, it's about a 50-50 split. 50% of the time, people say, I'm going to go on to Medicare now. 50% of the time, they stay on their current plan. Really just depends upon how good your current plan is. And that's one of the things that we help our clients with. You're also going to look at the cost, which is going to be better. You're going to have some choices when it comes to your Medicare plan. You can go out onto the open market and you can get a Medicare plan, or you can go through ASURA to get Medicare plans. So you're going to have these two options at some point when you make those decisions. We suggest a side-by-side analysis of your current plan versus Medicare to determine, is it better for me to stay with my Medicare plan or should I go ahead and make a change?
And have you guys done that with Arizona State's insurance?
Many times. Have we done that? So the question was, have we done this with ASRS previously? Yes, we do it all the time, where we actually lay out ASRS and their benefits. We lay out the potential benefits of the plans that are out there and compare the two. I will tell you that in most cases, the open market, for my client, probably 85% of the time, my clients go with the open market. So
I would echo that. I think that there's exceptions to everything, but I think the vast majority are going to the open market.
And this last bullet, we're not going to spend any time on because obviously there are more than 20 employees here at ASU. Another common situation, do we have any vets in the room by chance? Veterans, VA? Vets, thank you, sir, for your service. We appreciate it. As a vet, you're going to have choices because you have VA coverage possibly, or you may even have TRICARE for life. So your question is, do I want to enroll, do I want to just stay with the VA, or do I also want to enroll into Medicare? This is actually a page that comes directly off of the U.S. Department of Veterans Affairs, and it essentially says the VA, and I'm going to grab my pointer here for this one, the VA does not recommend veterans cancel or decline coverage in Medicare or other healthcare insurance programs solely because they are involved with the VA healthcare. And what it goes on to say is there's no guarantee that Congress is going to appropriate the proper funds for the VA to continue to operate as it does. So to summarize this page, it's saying make sure you understand what your options are, and we can certainly help you with that.
All right, so let's discuss some of the different Medicare enrollment periods that you need to be aware of. The first Medicare enrollment period that we're going to talk about is called your initial election period. So this is going to be for somebody who's aging into Medicare. I'm going to be turning 65 for the first time. It's actually a 7-month window, so it does include the 3 months before your birth month, includes your birth month, and then the 3 months after it. This is a very important time for most individuals because during this time you have guaranteed issue rights, or what Joe and I refer to them as is your golden ticket. What these guaranteed issue rights mean in a nutshell is that you can go out during this 7-month window during your initial election period, you can pick any company and you can pick any plan and you're guaranteed to get it. They cannot ask you any health questions, so no medical underwriting. If you do have pre-existing health conditions, they have to cover them, and they cannot charge you an adjusted or a higher premium if you do have pre-existing health conditions. So for somebody who's maybe not quite as healthy, this could be a really, really important time for them because it may be the only time that they have total freedom of choice to go pick the plan and the company that they want. Now, there is a way that you can maintain these guaranteed issue rights even if you go past month 7. So let's just say I enroll in Medicare in month 8 here. So I'm outside of that window. Now there is a way that I can maintain that guaranteed issue right or that golden ticket, and that is through group healthcare coverage. So if you have coverage through an employer plan or you maintain coverage elsewhere, you can still maintain these guaranteed issue rights. You could do that for a number of years. I mean, you could wait 2-3 years even if you wanted to, 5 years down the road. As long as you have something in place from when you turn 65 up until the date you decide to go on to Medicare, you will have that freedom of choice. Keep your golden ticket. If in that circumstance, you're going to be outside of your initial election period, you're going to have a different type of enrollment period. It's called a special election period, and that is the one that would apply to your situation. The only difference here is that you're going to have to prove to Medicare, essentially, show proof of continuous coverage from that age 65 up until the date you decide to go on to Medicare. The last enrollment period that you want to be aware of is called the annual enrollment period. And we just finished this one up a few weeks ago, and chances are you probably hear quite a bit more about Medicare in the fall. It is because of this annual enrollment period. It's for people who are already enrolled in Medicare. Some of the plans can and do change on an annual basis. So the reason for this annual enrollment period is so that you can analyze the plan that you have this year, make sure that it's going to continue working for you into the next calendar year, or if you want to, you can make changes to those plans from October 15th through December 7th. And I'm going to circle back to that. I know right now it probably doesn't make a lot of sense for me to say some of the plans do change on an annual basis. By the time we finish up, you're going to understand which of the plans are affected by that annual enrollment period. So am I automatically enrolled in Medicare? If you are drawing your Social Security at age 65, you're going to be automatically enrolled into Medicare. So this does not require you to do anything. You are going to receive a card in your mailbox about 3 months prior to your 65th birthday. And you do have the option to decline some of the parts of Medicare. I'm going to go back to the scenario that I just laid out for you. Let's say I have a group healthcare plan or an employer plan that I want to stay on. You can decline parts of Medicare if you want to, because you might not want to activate it right away at 65. But if you're taking your Social Security benefits, they're automatically going to send you a Medicare card in your mailbox. If you do plan to go on to Medicare, but you are not drawing your Social Security benefits, you do have to enroll yourself. So this does require some action. You can do it one of 3 ways. You can do it online. You can go to the Social Security office, or you can call them. Enrollment is fairly simple, but it can take some time, about 2 to 4 weeks. And another thing that has changed just a few days ago, as of January 1st of 2020, we were historically able to enroll people with their Social Security number through Medicare. That is no longer the case. They have gotten rid of the Social Security numbers, and you now have a Medicare Beneficiary ID number, or an MBI. So once you enroll yourself into Medicare Parts A and B, you get that MBI number, and you can choose additional coverage from there. Help fill in those gaps that Joe was referring to. So the parts of Medicare, and I told you earlier, this is kind of the meat and potatoes. If you really want to understand Medicare, you need to understand the next couple of slides. You can select some or all of the parts of Medicare depending on your particular situation. And these specific parts that you do decide to select is going to determine the type of coverage that you're going to receive.
Okay, so now I'm going to drill deeper and I'm going to start really getting into the parts of Medicare. And we're going to talk about two parts.
Sorry, I apologize. One thing I forgot to mention off the top, so shame on me. Anything with a star in there is included in your packet. So if you want to follow along or take notes, it might be helpful.
Yes. Question?
So I am already on Part A, Medicare A, at age 65, and then I won't convert until I'm 70. Now that the numbers changed, it's no longer our Social Security, will that automatically change for me? Will I get a new card with my
MBI?
NI number?
Yeah, you should receive a new card with an MBI number. You may have to request it though. If you've only activated Part A, that may be something that you would have to request from Social Security.
Can I ask a question? When did you do this? When did you activate Part A?
June of,
Pretty personal, bud.
June 1st of 65, 05,
Oh,
15.
You should,
June
then
1st
if
of
that's the
15.
case, you should already have the new card with the new number. So if you haven't received a new card with a new number, you need to call Medicare and get that new card.
So you need to look and see what numbers.
Right.
Thank you.
Most of our clients that are in that situation have already received a new Medicare card with that MBI, with the new number.
Thank you.
Okay, so we're going to talk about the parts of Medicare. There are 4 parts, A, B, C, and D. This is a very important concept for everyone to understand. A and B is known as original Medicare. And as we go through the next few slides, you're going to understand the importance of original Medicare. So the first part I'm going to talk about is Medicare Part A. And again, as Joe mentioned, these slides are in your handouts if you'd like to make notes. Part A covers hospital services. It also covers some inpatient nursing, hospice care, and home health care. But in general, it's covering room and board in the hospital, and that's it. There is no cost for Medicare Part A. You've already prepaid for Part A by paying into FICA. Medicare Part B covers doctor services. The easiest way to remember the difference between Medicare Part A and Medicare Part B is that Medicare Part A is room and board. That's it. Medicare Part B covers absolutely everything else, okay? So A and B, and those are known as original Medicare. Part C is one way that you can cover those gaps that we talked about that exist in original Medicare, and it's a Medicare Advantage plan. These plans are offered by private companies, and they meet all of the guidelines and regulations of Medicare, okay? There's also Part D, and this is going to be your prescription drugs. These plans are also offered by private companies. So a concept that's really important to understand right now is A and B are government, C and D are private companies.
Joseph, how much does Part B cost? Part B cost?
Oh, I'm sorry.
That's all right. I just want to make sure we cover it.
So I told you there's no cost for Part A, you've already prepaid for it. There is a cost for Part B. Thank you for catching me, Joe. The cost for Part B is $144.60 per month. And if you're drawing your Social Security, that comes out of your Social Security. If you're not drawing your Social Security, then you make arrangements with the government to pay that. The reason I tell you that is because a lot of individuals may not take Social Security until 70, but they might go on to Medicare before. And if you do go that route, you will have to pay that until you start drawing social.
I have a question.
Yes.
So if I have Part A, because I turned 65 in November and I have my card, and I go to, but I still have my group insurance because I'm still employed, and I go to the hospital, do I give them my medical card and my group insurance?
Yes.
Or
Yes, and your group insurance will be the first payer, and Medicare will be the second payer.
Okay, thank you.
Only if you spend the night. Yes.
Hospital, from hospital stays.
You got it.
This is going to be very important. If you plan on working past age 65, and we've already heard 2 examples of individuals who have said, I was eligible for Medicare, I went and I enrolled. I only enrolled in Medicare Part A. Okay? So if you plan to continue working, chances are pretty good you're going to want to enroll in Medicare Part A, and it's going to do exactly what we just discussed. Medicare is going to be the first payer. Your plan is going to be the second payer. Okay? There's one big exception, and I'm going to talk about that right now.
The group will be, your group plan is first.
Group is first.
Okay.
Group is first, Medicare is secondary. My apologies. Thank you.
I get confused easily.
So do we, obviously.
You got to check him, I guess.
Is anyone in the room funding a health savings account? Okay. No health savings account, so we're not going to spend time on this.
Is that something that would be of importance? No. In retirement?
Only if someone is funding a health savings account. I'll be happy to go over the slide if you'd like me to. Yeah, here,
Briefly.
yeah, absolutely.
Briefly.
Yeah, because I'm trying to ask online if anyone.
Absolutely. So Medicare says if you're funding a health savings account, you cannot go on to Medicare and continue funding that health savings account. If you do, what you're funding into that health savings account, number 1, becomes taxable, and number 2, there's a 10% penalty. So you do not want to continue funding a health savings account if you decide you're going on to any part of Medicare. Now, remember I said many of you, if you plan to continue working past 65, might go on Part A, but you definitely don't want to keep funding this if you go on any part of Medicare. Okay?
So a health savings account would be as if I were making a deposit to an account.
It can be either you or your company making deposits
Oh, I see.
into an account.
Any issue with you?
Joe, I have a question online. So just to verify, do you have to sign up for Part A at 65?
No, you can choose some or all of the parts. We do recommend that if you are going to continue working, it's in your best interest to sign up for Part A, but you do not have to.
Really, you're making a choice. Is it more important for you to keep funding your HSA in the interim until you go on to Medicare? Or would you rather have that additional Part A coverage as a secondary payer potentially? That's kind of what you're weighing there, I think.
Okay, gaps. We talked about gaps in Medicare. Excuse me. Now I'm going to real quickly cover gaps briefly, but I'm not going to get into all of the detail. However, remember we said you can choose some or all of the parts. Some people are going to choose Medicare Part A only. So if you chose Medicare Part A and Part B only, and that's all you chose, Medicare generally is going to cover about 20%, and you're going to be paying the rest out of pocket, okay?
Flip that. Medicare covers 80, you pay 20 out of pocket.
Sorry, thank you. So with that said, these are gaps in coverage that if you only had A and B, these gaps would exist. We want to show you plans that cover some or all of these gaps today.
Okay, can you go back?
Sure.
Can you go back? So what is the 61 to 90, I assume years old, 352 a day? What does that mean?
If you have to go into the Part A is hospital. If you have to go into the hospital, there's a Part A deductible, $1,408. If you only have A and B, you pay that out of pocket. If you have to be in the hospital between 61 and 90 days, it's $352 per day. If you're in the hospital between 91 and 150, it's $704 per day. So that's if you're in the hospital and you only have A and B. But remember, we're going to show you plans that pick up all of these costs. some or all of the costs.
When you say there's skilled nursing, 1 to 20, is that years or what?
Days.
Days.
Same as up here. It's zero cost on days 1 through 20, 21 through 100. It's 176 per day. Okay,
Thank you.
you bet.
Joe, I have another question online in regards to the HSA, just to back up. So what if I already have money in an HSA, but I'm not actively funding it?
Great question. You can use that money and you can spend that money towards certain things. There's one thing you can't spend it toward, and that's a medical premium, but you can still use that money and you can use that towards your medical expenses.
All right, so selecting your plan type, and here's where you get into filling in those gaps. So what are the two ways that we fill in those gaps that Joe just explained to you? You have two options here, and you have to have parts A and part B activated to enter into either one of these plans. The first option that you're going to have is going to be called a Medicare Advantage plan. Medicare Advantage plans are going to include all four parts of Medicare, A, B, C, and D, into one plan. Most of these plans do include prescription drug coverage, so they come with your prescription drug coverage, and we're going to get into more detail on this plan. You're agreeing to the terms and conditions of a private healthcare company here. So you have original Medicare A and B. If you choose a Medicare Advantage plan, you're getting rid of your original Medicare, and instead you're saying, I agree to the terms and conditions of the company that I chose. I'm going to go into a lot more detail on what I mean by terms and conditions in just a moment here. These are through private healthcare companies, and they are approved and sanctioned through Medicare. The other option that you have is to maintain your original Medicare. Remember, that's A and B, that's through the government. There are gaps in Medicare, though, or in original Medicare A and B that Joe just talked to you about. A Medicare supplement is intended to fill some or all of those gaps in coverage. Okay, so Joe talked about Medicare covers about 80%. This is where you're covering that other 20%. In addition to that, you would have to add a Part D prescription drug plan. So if you go the route of maintaining original Medicare, you purchase a supplement, you're not going to have the drug coverage there, so you're going to have to also purchase a separate Part D prescription drug plan to fit your drug needs. And we're going to talk in a lot more detail in a moment here about these. But I just want to show you this so you understand how it looks structurally. If you have a Medicare Advantage plan, you no longer have those gaps in Medicare, but you have terms and conditions. Over here with a Medicare supplement, you're filling in those gaps that are not covered by Medicare.
And do you still pay the $144.60?
Correct. Regardless, the question was, do you still pay that Part B premium, $144.60? The answer is yes, regardless of which type of plan you go on here, because you have to have A and B activated, and B has that premium, you're going to pay it.
All right, so any Advantage plan has A and B, but you're still paying Medicare for the A and B, and you're paying them to bundle it all together and give you C and D.
Generally, that's a pretty
Yeah,
good
that's
description.
pretty close. Yeah,
Yeah.
yeah.
Just checking.
Can you repeat what he said?
I'm sorry. So generally, what you're doing here with the Medicare Advantage plan is you're taking all four parts of Medicare. So you have A and B Medicare, regardless of which side of the aisle you're on here. But the Medicare Advantage plan also covers you for the C and D. So it covers all four parts of Medicare, as opposed to having to purchase it separately over here with the Medicare supplement.
Thank you.
Do we have a question?
So if you're paying directly from your Social Security into the original Medicare, right? So when you go to an Advantage plan with a private company, so how does that work?
Well, actually, that's the very next slide. So if it's okay with you, we're going to cover that on the next slide.
Perfect. Thank you.
Perfect.
All right, so let's take this a step further, and I want to more succinctly explain to you what I meant by terms and conditions, because I know that's probably a little bit foggy at this point. What do you mean terms and conditions? Well, here's where we're going to kind of bring it all together, and I think By the end of this slide, you should understand the difference between these two types of plans, and you'll realize that they're essentially polar opposites the way that they are structured. We have Medicare Advantage plan is on the left and Medicare supplements are on the right. So I'm just going to go through this line by line and I'm going to explain to you the differences between the plans. Medicare Advantage plans, you do not maintain your original Medicare. So this is considered a substitute for your original Medicare. And instead of having original Medicare and the gaps that go along with it, you're agreeing to the terms and conditions that I'm going to lay out for you in a moment here. You are not the sole decision maker here because you are agreeing to those terms and conditions. That means that you're going to have a network or a service area of both doctors and hospitals that you could go to. Important to understand about most Medicare Advantage plans is that they are county-based. So typically, if you are enrolled in a Medicare Advantage plan, it's going to be specialized to your area and to your zip code and to where you live, where you reside. That could also mean that, and this is not intended to freak you out, but let's say I go up north and I'm skiing for the weekend and I twist my knee and I have a Medicare Advantage plan that has that service area or network, you're going to be covered for emergency services. So I don't want to freak anybody out about that. But if I want to go to a knee specialist and I'm in Flagstaff, I'm probably going to pay the full cost of that visit with most Medicare Advantage plans. So just be aware of how that works. Most of the Medicare Advantage plans on the open market are going to be HMO networks or PPO networks. I think most people are familiar, but I'll fill in the blanks. An HMO network is going to require that you stay within your network to get all of your services done. A PPO network will allow you to go outside of the network, but you would expect to pay a higher cost if you use doctors or hospitals that are outside of that network. Very similar to probably group healthcare plans or individual plans that you're accustomed to. Medicare Advantage plans are also going to require that you select a primary care physician when you do sign up for the plan. That also means that if you need a referral, so same scenario, if I twist my knee and I have a Medicare Advantage plan and I want to go to a specialist, I'm first going to have to get a referral from my primary care physician. They'll recommend me a doctor that's within that network. Policy or a certificate. I told you very early on about the annual enrollment period, and I told you I was going to circle back to it. Well, here it is. Medicare Advantage plans, all these terms and conditions that I'm laying out for you can and do change annually. So if you do decide you want to go with the Medicare Advantage plan, be aware that the plans run and the coverage runs from January 1st through December 31st. And that's why we have that October 15th through December 7th deadline so that you can select a plan for the next calendar year moving forward. So that's a very, very important distinction here, I think, because a lot of people will do this. They'll sign up for an Advantage plans and wash their hands, leave it alone. Probably not the best idea because it's potentially there's potentially a better plan out there for you. They change year to year and you need to be aware of that. Medicare Advantage plans do have co-payments and co-insurance, so you're going to pay out of pocket with this plan when you go see your doctor. You're typically going to have a flat fee, a co-payment for some services, and other services have co-insurance, which is going to be a percentage that you're going to pay. Medicare Advantage plans also include prescription drug plans in almost all cases. I do believe there are only about 2 Medicare Advantage plans in the market this year that don't include your prescription drug coverage. Almost all of them have that with it. Monthly premium, 0 to a low monthly premium. Most Medicare Advantage plans in Arizona do not have a premium. You don't pay anything to actually be enrolled in the plan, but where you're actually going to see an effect financially is on the back end. They do have yearly maximum out-of-pockets, and this is dependent on the specific Medicare Advantage plan that you choose, but they range anywhere from $3,200 up to $6,700 annually. So essentially, you're not paying, in most cases, that's a blanket statement, but most Medicare Advantage plans don't have a premium on the front end, but you pay as you go. You pay those co-pays, you pay the co-insurance as you go see your doctors and go get services done. So that's one option, and that's called the Medicare Advantage plan. That's the one that puts all 4 parts and puts them into one. The other option that you have is called a Medicare supplement. You do maintain your original Medicare, and that means that you're going to have freedom of choice.
Can I stop for one moment?
Yeah.
I think we have a typo up here. Should say yes under Medicare supplement.
Oh, that definitely should say
Yep.
yes. Yeah.
Okay, yay.
Yes, that means
So-
yes.
Since this is on, since you do have this slide, if you could make that correction,
How
that
did
would
that-
be great. Thank you. And we apologize.
Apologies there. That's a,
That's a big deal.
yeah, that does matter.
Okay, hello. Also, under the Advantage plan, you're still paying for original Medicare, right?
Correct.
So, I mean, that also says no, but you should know that you're still paying Medicare costs. There are no premiums for your Advantage plan, but you still have to enroll in Medicare.
Correct.
Right,
A and
it's
B,
not-
regardless of if you go with an Advantage plan or with the supplement, you're going to be paying that Part B premium, the 144 and change for most people.
Right. So that first top of the column there where it says no, it's a little bit confusing, to me too. I mean, I understand that, but you're still paying for Part A and B.
Right.
Yeah, you're going to have a premium with B.
Right.
Yeah.
Okay, thanks.
So Medicare supplements, you're going to have a lot more freedom of choice on this side because you don't have a network to speak of. You don't have that same service area, so you're not necessarily going to have as much trouble finding doctors with this. Most doctors accept Medicare. 97.2%, I believe, is the last number that I saw of doctors in the United States take Medicare. And the only distinction if you have a Medicare supplement is if they take Medicare, then they have to accept your supplement. So no networks to worry about. That's where you get into more freedom of choice on the supplement side of things. There are different supplement plans to choose from. They range from plans A through plan N. All of those plans cover those gaps in Medicare that I keep referring back to that Joe showed you a little bit differently. The two probably overwhelmingly most common plans on the market are plans F and plan G, and those are sort of like the Cadillac plans. They cover the majority of those gaps in Medicare. So you have very little out-of-pocket costs with those two plans. Medicare supplements do not require you to select a primary care physician. You can select your doctor at will here. As long as they take Medicare, you can go to them. That also means that you don't have to get referrals. So same scenario, if I twist my knee and I have a Medicare supplement, I can just go straight to the doctor of my choice, to the specialist of my choice. Medicare supplements also do come with a policy. So I told you with a Medicare Advantage plan that those terms and conditions change on an annual basis. Medicare supplement, the benefits here are not going to change. So as long as you continue to pay a premium, your coverage won't change with the Medicare supplement. Out-of-pocket costs as you go to the doctor, you have in some cases, no out-of-pocket costs, so co-payments and co-insurance, and this is dependent on the plan that you choose. So some of them have a little bit out-of-pocket, but others will cover all of those gaps in full. So you're not paying as you go with the Medicare supplement. And the Medicare supplements do not include your prescription drug coverage. So if you go this route and you want to decide to stay on original Medicare, add the supplement, you are going to have to also purchase a separate prescription drug plan. And we're going to go into more detail on prescription drug plans and the differences here in a moment. And then finally, let's talk about money. Polar opposites here. Instead of having a $0 premium like you did with the Medicare Advantage plan in most cases, you are going to have a low to a modest monthly premium, but very little out of pocket depending on the particular supplement that you choose. F is the one that covers all of the gaps in coverage. G covers all the gaps with one exception. So total out of pocket here, depending on the plan you choose annually. Now, what is low to modest? I know it's coming. What's low to modest, Joe?
Let's talk about, let's talk about pricing on Medicare supplements. So again, and I think we've reinforced this, everybody's paying for A and B, so you pay your A and B charge. A Medicare supplement for, and we're going to use Plan G as an example. Your maximum out of pocket in a calendar year is $198 with Plan G, okay? For Plan G, you're going to pay about anywhere from $125 on up per month for Plan G, okay?
for a 65-year-old. And the rates go up a little bit if you're a little bit older than that. But at 65 is what was kind of the baseline that we use.
So really what you have to look at, and I'm going to summarize this slide here and say, if you choose a Medicare Advantage plan, you have, in most cases, no premium. You don't pay a premium. But you have all these copays and coinsurance, which could add up to a pretty significant amount of money each year, okay? Polar opposite when you have a Medicare supplement. You're paying that premium up front, but you have very little out of pocket on the back end.
Real quickly before we move on to, I want to talk briefly about switching from one to the other. Because let's say you want to start on one side and you want to switch to the other. Let's start with, I signed up for a Medicare supplement and now I want to switch back to a Medicare Advantage plan. You can do that. It's very simple to do as long as you enroll yourself during the annual enrollment period. So from October 15th through December 7th, you're always able to go from a supplement back to an Advantage plan. Okay? Let's say though, if I start with a Medicare Advantage plan and I want to move back to the right to a supplement. Remember early on, I told you about your initial election period and your freedom of choice, that golden ticket. Freedom of choice to go out and pick the company and the plan that you want to. If you're outside of that enrollment period, you're no longer gonna have those guaranteed issue rights. So you can always apply for a Medicare supplement, but at that point, you'd have to be healthy enough to be accepted into it. So you lose that guarantee, you lose that golden ticket potentially. So if you're on the fence, I'm not trying to tell you one way or another what to do, but that could be a determining factor for some people is there's no guarantee that if you start with an Advantage plan and you want to move to a supplement that you're going to get into it.
Yes.
Did I hear something about a Plan F not being available anymore if you don't elect it at age 65?
Yes, and I was going to cover that. So,
Okay.
For individuals who are over age 65 and already enrolled in some form of Medicare, you can get a Plan F, okay? So let's say you have Part A, and we've heard from a couple people that have Part A. 2, 3, 5, 10 years from now, you decide, I'm ready to retire, go on to Medicare. You can get F. You can still get it, and it will have zero out of pocket. New enrollees into Medicare that enroll after January 1st of 2020, just a couple days ago, Plan F will no longer be available. So,
Thank you.
We felt like it was appropriate to cover because we figured we may have some people that can still get into Plan F if they choose to,
Right.
and you have that option. Yes.
Okay, on the supplement, it says that this policy and the benefits don't change, but the monthly premiums do?
The monthly premium can, and I can just tell you it will. I would never ever give you the expectation that the rate that I would quote you at 65 is going to be the rate for the rest of your life. Medicare supplements certainly do go up, but I think really what you're getting into, if you pick the right company, I think it's a little easier to stomach. There are some companies out there that historically have had, will bring you in at a really low rate and then give you substantial rate increases. And if you're unlucky enough to be unhealthy at that point and you can't go to a different company, you're kind of stuck there. So that's where I think, I do believe that choosing the right company is very important when you're talking about rate increases. That's one of the most important things I think about.
and with that said, I will tell you that we only use A-rated companies. There are so many good companies out there that are rated either A+, A, or A-. There's really no reason to even go into the B's, the C's, the D's, and frankly, you just don't want to. So, and we will only represent an A-rated company. Any questions on this slide before we move on? And we can always come back to it, so.
All right, so let's expand and talk about prescription drug coverage a little bit more. With a Medicare Advantage plan, I already told you most of those plans include your drug coverage. It comes with it in almost all cases. That's very much a positive because you're getting that drug coverage and it's included in the plan. Could potentially be a drawback for some individuals depending on the particular prescriptions that you're taking. Because with the Medicare Advantage plan, you're going to have sort of a one-size-fits-all type of a scenario there. They have a set formulary or a list of prescriptions that they're going to cover. let's say that I happen to be on something that is not on that formulary or is maybe on a higher tier there, I'm probably going to want to shop around and find a different Medicare Advantage plan that better suits my prescription needs. With a Medicare supplement, you're going to have a little bit more freedom of choice here. There are standalone prescription drug plans that are sold by the healthcare companies, and there are 28 that are available to you in the state of Arizona. So in this scenario, and this is something we do for all of our current clients, is we will take a list of prescriptions that they're taking and we will compare them. We will compare those 28 different plans, and based on their specific drug needs, we can tell them essentially which of those plans is going to be the lowest out-of-pocket cost for the calendar year. Medicare prescription drug plans, pardon me, do also change on an annual basis. So I told you about that annual enrollment period. These prescription drug plans are also going to be affected by that. So same thing with the Medicare Advantage plan. I told you about some people just sign up for it and then wash their hands of it. Please don't do that, because I have seen the exact same list of prescriptions and it's just a couple months difference. It's the next calendar year and it's like a $2,000–$3,000 difference for the exact same list of prescriptions, same frequency. So be aware of that, and that's something we can help educate you on as well.
Okay, what's not covered by Medicare? Generally, Medicare does an amazing job. However, there are some things that they don't cover. Original Medicare does cover skilled nursing for up to 100 days. What original Medicare does not cover is long-term care. The reason we're telling you this is because people who are on Medicare think they have a long-term care plan. That would be a huge mistake if you walked out of this room thinking you had long-term care. You have skilled nursing for up to 100 days with Medicare. Okay. Some of the items that are not covered: most dental care, eye exams, and related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids and exams for fitting them, and routine foot care. Okay, we're going to talk for a minute about something called IRMA, Income Related Medicare Adjusted Amount. And what IRMA is if you are reporting on your taxes as an individual $87,000, and it's going to be based upon your MAGI. If you're reporting $87,000 as an individual or $174,000 jointly, your Part B and Part D premiums are going to be higher. Now, I know this chart is kind of hard to read, so we brought some extra copies. If anyone falls into these categories, there are some numbers here that you're going to be very concerned about, obviously, and we'd be more than happy to hand these sheets out to you when we're done.
Joe, I have a question online in regards to prescriptions. Are there any drug plans that refuse to cover brand name medications, or are there plans that will cover brand name and not only generic prescriptions?
So one important thing to understand about all of the prescription drug coverage that is on Medicare and is available is that they have a list of prescriptions that they have to cover. So a base list of prescriptions that they have to offer 2 different options on.
2 options for every condition out there. Okay, there are late enrollment penalties, and we just real quickly want to make you aware of them. We said from the very beginning, they're super easy to avoid. You just have to know that they're out there. And the first one is Medicare Part B. If you don't enroll when you're first eligible for Medicare Part B, there is a penalty. But I'm going to preface this by saying, if you're working and you have a group health care plan, don't worry about these penalties. They're not going to apply, okay? So the Part B penalty, if you fail to sign up for Part B, it's going to be 10% for each year you neglected to sign up for it, and it's a penalty that lasts you a lifetime. It sticks with you a lifetime, okay? So that's the penalty for Part B. For Part D, there is also a late enrollment penalty. If you don't sign up when you're first required to, at age 65, there's a penalty. Again, preface that with, if you have group health care, don't worry about these penalties because they're not going to apply. Now, there's something called creditable drug coverage. This is very important, and I'm about 99.9% certain that ASU offers creditable drug coverage, but there is a potential if you found out you were on a plan that didn't have creditable drug coverage, and let's say you sign up for Medicare at 67 instead of 65, you could have this potential penalty if the coverage that you have is not creditable drug coverage. Does that make sense to everyone? Okay. Now we'd like to tell you just a little bit about us. First of all, we want to tell you how we get compensated. We are contracted with all of the different companies out there. And if you decide that you would like to work with us and you would like to be a client, then the company that you select is going to compensate us. We never charge you a fee, not one penny. The plans that you end up and select end up and compensate us. And that's very important for you to understand because there are a lot of agents that you may see them one time and never hear from them again. We don't do that because we get a residual. So for every person that we have on our books that stays with us, then we're going to get a monthly residual. So it's to our benefit to give stellar customer service and really work with our clients. Some of the additional services that we are going to provide is, obviously everybody's situation is probably different in this room. We're going to sit down and we're going to do a one-on-one with you and help you out with one-on-one education. Start to finish Medicare enrollment so we get it right. We don't have penalties. We're going to prepare multiple coverage options and price quotes, including a comparison between ASRS and the open market. You have our cell number, and we think that's pretty important. So, okay, so what's next for these Sun Devils that are in pre-retirement? Go Sun Devils. Which company or which agent are you going to work with? Make sure you enroll early because of those new 2020 regulations. You need to get that new MBI Medicare number. So if you're going to enroll, some people will, some people won't. Some people may enroll in certain parts. If you have group health care, you're probably only enrolling in Medicare Part A. We talked about avoiding the penalties. It's very easy to do. Do you want a Medicare supplement or do you want a Medicare Advantage plan? Which is right for you? I can tell you that the numbers say across the country about 70%, 69% of individuals have Medicare supplements and 31% have Medicare Advantage plans. Which company is right for you? Which plan is right for you? And if you choose a Medicare supplement, we're going to have to help you with getting the right Part D plan. We have one last thing. We want to thank you very much for coming today. We have a survey in your folders, and if you don't mind filling it out, we like to look at it as a report card when we're done. We plan to be around for a few minutes, so if there are any questions with our live audience today,
Or
we
on
can
that.
certainly answer some questions.
I have a question online. Back to the IRMA. Is there a difference between the MAGI and AGI? Is MAGI always higher than AGI?
I am going to defer and say I'm not an accountant. I can't answer that question.
So let's say I decide I'm 64 now and I am planning to retire at 66. When do I contact you to sit down and make my choices?
About 3 to 4 months before you turn 65, because what we're probably going to have to do in your case is activate Medicare Part A, very easy to do, and just get A in place. Then when you do decide to retire, we'll look at, okay, now you're going to have to get B, and then if you want to get a Medicare supplement or Medicare Advantage plan to add to it.
You can sign up for a Medicare supplement 3 months prior to your actual start date. As long as you have Part B activated, you can sign up a few months in advance.
This is I guess I didn't explain myself correctly.
Okay.
So I'm covered by United Healthcare here.
Mhm.
So if I activate Part A, do I have to start making those premium payments also?
No, Part A costs zero. There's no
So it's
cost.
only on Part B where we start
Part
paying.
B, correct.
And
And
we
that's on one of your slides.
And we only need to activate Part A.
Correct.
If you're gonna stay if you're gonna stay enrolled on your group plan, if you're gonna stay in, on the plan that you're on currently with that UHC plan.
Yeah, to make it very simple, if you plan to continue working and you have a group healthcare plan, we recommend that everyone sign up for Medicare Part A when they're first eligible. Yep. All right, well, thank you very much, and we
Thank you so
appreciate
much.
this opportunity to speak with everyone.
Thank you, thank you. So, and we have, they've left extra packets, so those of you in our online audience, just send Liz Valdemente.
I put it in the group chat, my email
Great.
address.
And she'll get those out to you, and then we're always available for questions if you have other ideas. I'd like to take just a second. Remember that this event is always sponsored by the Retiree Association, people who've been here and worked in the buildings that you're in and walked on the sidewalks. Well, not in all the buildings you're in. But our Retiree Association is very important to the structure of the university. So they sponsored this event to help us prepare because many of them were not as prepared as they would have liked to have been. So if you have topics and things, please send Liz or I a message. We'd be happy to look into those. I'd like to recognize our current president of the ASURA, Jan Thompson, who is a retired faculty from the School of Music, and just let her say a few things.
Thanks, Trudy. And I'm just here to invite all of you to join the ASU Retirees Association. You don't have to wait until you're retired, as Trudy has been a member for several years already. So contact us. We have an office on Curry and, well, close to campus, the Community Services Building nearby, and a phone number. You can find us online, asura.asu.edu. I'd also give a testimonial to these gentlemen, the Cranies, who are partners with my insurance agent, Brian Bilyeu, and that's how we found them for today. I've had wonderful service from Brian for the last 7 years that I've been retired. So I can give you a strong recommendation for the quality of their work and how well they have taken care of me in my retirement and making choices on healthcare and supplement plans and so forth. So thank you again for being here today, everyone, and we'll see you next time.
And no matter how soon you intend to retire, think about the future. It's happening faster than you think. Mine is ticking away too fast at this point. Have a great New Year. Thank you all.
Thank you.
Absolutely. Oh,
Thank
good.
you. Really appreciate
Good.
that.
We like hearing great.
See, this is what happened when I turned 65.
Thank you so much.